Hey, how's it going, guys? It is Dr. D over here at Midtown Optometry. Hopefully, you guys are having a great day. But I've been having, a lot of patients actually been showing up with some really irritated eyes lately. And I wanted to go ahead and do a Facebook Live video about those symptoms that patients have been showing up with. And, the patients actually would come in with a really red, really irritated eye. There's a burning, there's itchy and just red, and it's really watering all the time too, and they don't know what the heck's going on. And so what's happening was that, there is a likelihood that there is what is called a ocular surface disease that is really problematic, very common actually too, where, patients, especially in women, are affected too, because on the front surface of the eye, called the cornea, they have a lot of nerve endings on the front surface of the eye that causes this type of reflex reaction too. Usually it is related to what is called a tear film dysfunction. So go ahead and schedule an appointment in our office. Go to midtownoptometry.com and we'll go ahead and do a workup on you and see what's going on. But let me go and flip this camera around really quick, and I'll show you exactly the anatomy of it and kind of like give you the rundown in terms of what we see and what we can do, and some examples in terms of what happens if you're or somebody that's experiencing these type of symptoms. So the symptoms again for these patients are burning, itchiness, redness, and tearing, and usually is correlated with a tear film dysfunction. So first off, let me flip this camera around. All right, so this is the education software that we use, and it's pretty cool. So this is a diagram of an eye itself. So there's three different types of tear glands that are usually culprit of things. There's one type of tear gland here in your upper and lower lid. These are called the meibomian glands, and they're responsible for the oily part of the tear film. And then you got two other guys here too. Here's these other tear glands here. There's three different types of tear glands, and the tear glands, the output of them, if we zoom in, you actually see these little dots right here. Right, and that's where the tear glands would actually excrete the tear film onto the eyeball itself. And then the reason why the tear gland is so important is because it lubricates the front surface of the eye, it protects the front surface of the eye. It also acts as a really smooth optical surface too. So if you have a really inconsistent tear film, then the tear flow goes like so. Check this out, watch this. So the tear flow is produced, tears are produced, and when you blink, it squishes out the tear ducts themselves and goes through the nasal cavity as well. And let me show you again. Let me do that one more time. So the tear glands are produced, coats the eye, boom, goes right out. Okay. So there's usually some sort of a disconnect of the tear film production, and what ends up happening. Let me zoom on here. So essentially, the tear film is supposed to protect the front part of the eye. Now the cornea, the clear part of the eye that I showed you guys earlier, they're made of a couple different layers of the cornea itself. There's a little pink area that looks kind of like a piece of bubble gum. That's called the epithelial layer, right? And there's this area actually gets regenerated, sloughs off a lot of times too. But this is the culprit. A lot of times there's dry spots and dead cells, and it's being sensed by the front part of the eye, and it causes a lot of those redness and tearing too. And this whole point of this epithelial layer, this bubblegum pinkish layer here, is to protect everything else underneath. The stromal layer, the endothelium too. And just as an FYI, this blue part right here, this is where we would first off operate for laser surgeries to correct people's prescription. Hey, what's up, Michael? How you doing? And so that's what's really cool about the cornea. So in any event, there's dead cells that are usually found on the white part of the eye, on the pink part right here, the front part of the eye, and that's what causes the reflex reactions of the patient. So let me go back over here. Let me go back here again. So back out here. So what we do is that we would take what's called BioGlow. Let me go up here real quick. So here's BioGlow. Let me get some out here. So BioGlow is a fluorescein strip, and we would go ahead and open these little BioGlow strips right here. We would put, go ahead and put the fluorescein strip onto the eyeball, and it will light up the eyeballs like a Christmas tree. And in the slit lamp, the microscope, what will happen is that this front part of the eye, when I look in the microscope, it will look something like this. And so you can see here that the dead cells, these are called fluorescein staining, and the diagnosis in this patient in particular is called superior punctate keratitis, or SPK for short. And this is what causes the redness, the burning, the itchiness, the watery eyes, because these dots right here, this little coalesce of these dead cells, is because this area is being exposed to the elements without proper lubrication, which is therefore causing a lot of the problems too. In a more extreme case, you can see this is no bueno at all. And imagine trying to, and this is the pupil, by the way, the patient, imagine trying to go through and try to drive down the street. You won't be able, it's like trying to look through stained glass pretty much too. So you can basically see that, a lot of times patients, you just see a regular person with really red eyes and they don't know what the heck's going on. And it has to do with a tear film dysfunction. And so with the symptoms that occurs, go ahead and schedule an appointment with me at midtownoptometry.com. Also go to, give us a phone call too, at 209-957-8000, and we'll be more than happy to help you guys out. If you know somebody that's affected by it, or you yourself are affected by it too, go ahead and share this video in the comment section, put #shared. If you're watching the replay, by the way, of this video as well, go #replay, and I'll go ahead and give you guys a shout out on this video. But ladies, this type of tear film dysfunction happens in ladies twice as much as more than men, because lovely hormones, yay. And also too, if you can think about it too, a lot of ladies have the eyelash extensions too, and a lot of times the adhesive that is on the lashes themselves. If I flip the camera back around again, going back to here, here's the tear glands themselves. If I zoom up on here, the adhesive on the lashes themselves can be right in the lid area, lid margin there, but sometimes there can be some accumulation of eyeliner, mascara, any type of makeup and everything too, can plug up those little tear glands right there, okay? And that can also affect the tear film production. What's up, Gary? And so therefore it can also affect the tear film flow and production to lubricate the eye. And nothing is better than having an eyeball that's nice and lubricated and happy. That's supposed to happen. And if it doesn't happen in that sense, what ends up happening, quite honestly, is that, which is not a fun eye, or this, which is not a fun eye either, but there's actually resolution for this too. And we would go ahead, depending on the severity of it, we would definitely prescribe lubricating eye drops for one, but also two as a prophylactic measure to avoid any type of potential bacterial infection. Because remember, the dead cells there's no more barrier for the elements, so bacteria can actually get into the corneal tissue itself, which is this part here, can get inside and cause a bacterial infection, and that is not fun. It could cause a lot of inflammation. It can cause a lot of just a big mess. Contact lens wearers too. A lot of times it can be contact lens related as well. So those of you that have a tendency to utilize a 2-week disposable contact lens or a monthly disposable contact lens is longer than you should, you're adding more risk to having this type of situation occur, because you're just beating up the front part of the eyeball, and it can only take so much. And dead cells don't feel anything too. Okay, so go ahead and make sure that you go ahead and make an appointment so we can make sure your eyes are tip-top shape. And contact lens wearers, I personally set up all my patients with the daily disposable contact lens, because you get a fresh clean pair every single day. Two, there's nothing like having a fresh new pair, because it's like having new socks every day, right? And it has the best in terms of oxygen transmission and permeability. So in the event that you are wearing the contact lenses for a long period of time, well, guess what? You have the best contact lens to use for that particular purpose too. So if you're a contact lens abuser, wearing a 2-week lens for say 3, 4, 5 weeks or more, or if you're a monthly replacement user for contact lenses and you're using for 3 months, you're asking for trouble. But then again, that's what I'm here for, to go ahead and educate you guys If you want more information in regards to some of the other symptoms or what potentially can be, go ahead and shoot me an email or message me on Facebook or something like that. My email, by the way, is Dr. Lee, DRLEE, at midtownoptometry.com. Shoot me a private message on Facebook if you want more information. I do have some information I can email you to for free in regards to the contact lens technology that we can do, and also give you more information. Okay, so if you want more information, I'll be more than happy to help you guys out. Okay, send all your friends, send all your family. 2018 is about to end. Use it or lose it program. So if you haven't utilized your 2018 benefits yet, go ahead and utilize them, because if you don't use it, you lose it. So refer all your friends, your family, your neighbors, your cousins, your second cousins twice removed, as I said before. But I do appreciate everybody for sending all the friends and family to us, and I'd be more than happy to help. Dr. D, I'm out, and I'll see you guys later.